So we're gonna pull hard. All right, on your back. Move down. A little more. All right. The floor is so squeaky. All right, so we're gonna put these pillars in, and remember last time it was a little tight?
Yeah.
So let's try, we want it tight because I don't want you sliding that much.
Yeah.
The tighter it is, the more of a decompression effect it'll have down the whole spine. All right. Breathe in and let it all the way out. So remember what we're gonna do here. We keep our teeth together. We're gonna breathe in and out through the nose. Down. Breathe in and let it out. Good. Wiggle your right big toe. Wiggle it. There we go. That was a nod of approval, correct?
Yeah, that was a good one.
That was a really good one. I felt it really release. I love it.
Yeah.
Breathe in and drop your head down. Drop this head down. Drop this head. There we go. Good. Breathe in and let it out. Drop this. Don't help me. Wiggle those toes. Yes. That was a really good one.
Fantastic.
And still kicking. Okay, that was a fantastic release. All right, we'll take these pillars out. Hear those sighs, breaths of relief?
Yeah.
Stand up. You should feel taller, lighter, more open.
Yeah.
All right, great. Go face down. Let's hit the rest of your spine. So yeah, Dr. Johnson, if you're watching this, thank you for developing this technique. It really is a game changer. Help patients come in with all kinds of problems, get better. And only a few visits, not 20, 30 visits, like 6, 8 visits. Seeing amazing results. Good, breathe in. And let your air all the way out. It's going to follow you down. Bend your knees. There we go. Forward. Breathe in and down. Good. Good. Gotcha. There we go. Perfect. Okay, sit up. Let me help you up. 1, 2, 3. We're all happy with the care here. Good. Breathe in and let it out. Drop this. There we go. There we go. Good. Stand up, instrument work. But it's a proprioceptive or neuromechanical adjustment stimulating what's called the mechanoreceptors or joint receptors. And you have a lot of them in your SI joints, a lot of them in the transitional segments. Bring those shoulders back and chest out. So cervical thoracic junction, there's a ton of them. And this helps kind of lock in the effects of the adjustment for a little bit longer, stimulating better posture. Okay, perfect. All right, good job. How's that feeling?
Pretty good.
Good.